Hi, I'm Dr. Christina Han, dermatologist and medical director at XYON. Today I wanted to address a question that many people have. Is oral or topical minoxidil better? Topical minoxidil is an approved agent for hair loss that's available over the counter as a topical solution for female and male pattern hair loss. However, oral minoxidil is quickly gaining popularity as an off-label treatment option for thinning hair. Let's dive in and take a closer look at these treatments. How do oral and topical minoxidil treat hair loss? Both oral and topical minoxidil share the same mechanism of action. The medication's effects on hair are complex, but it's thought to improve circulation and as a result, better blood flow to the hair follicles. This allows for better oxygen and nutrient exchange, allowing for further promotion of hair regrowth. It's also thought that minoxidil also improves the hair cycle by having that hair follicle spend more time in the anagen or growing phase, allowing for further growth rather than resting and falling out. Do you have any studies on the efficacy of oral versus topical minoxidil? Which one works better? When it comes down to which version of minoxidil is better for you, it really comes down to the patient. Oral minoxidil may be a better option for somebody that has failed to respond to topical minoxidil or has experienced side effects. The reverse can also be true. So what accounts for these differences in efficacy? What we think is a process called sulfation. Before it can take effect, minoxidil needs to be converted into its active form, minoxidil sulfate. Your body does this with the help of an enzyme found in hair follicles. However, this enzyme can vary from individual to individual. For example, for some people taking topical minoxidil, they may have less of the enzyme needed to convert minoxidil into the active form. This means that less minoxidil is available downstream to promote its efficacy at the level of the hair follicle. When you take minoxidil orally, however, this conversion takes place in the liver, which is usually a much more efficient process to convert minoxidil into its active form. There are very few clinical studies that directly compare oral to topical minoxidil. One 2019 study found that oral minoxidil was slightly more effective than topical minoxidil in female patients after 24 weeks of treatment, but it's unclear whether these results would apply to male patients. What are the side effects for oral and topical minoxidil? The side effects for minoxidil will partially depend on what format of minoxidil you're taking. For oral minoxidil, possible side effects include dizziness, lightheadedness, headache, swelling of the hands and feet, as well as unwanted hair growth in other parts of the body. Also, palpitations or a faster heart rate are also reported, so if you have a history of heart disease, it's important to talk to your doctor before you go on this medication. Topical minoxidil, on the other hand, can have skin-related side effects because of application to the scalp. This can include dryness, flaking, and irritation. Finally, for both topical and oral minoxidil, remember that shedding with any hair loss treatment can occur in the first few months of therapy. This is often temporary and often signifies a resetting of the hair follicle. If, however, the shedding doesn't resolve within 3 to 6 months, it's important to reach out to your doctor to look for other causes of hair loss. This was our primer on the differences between oral and topical minoxidil. We hope you found this helpful. As you can see, there are both great options depending on patient preference, as well as slight differences in efficacy and safety. Ready to start your hair growth journey? Start by filling out an intake form at XYONHealth.com to get connected with a specialist physician to look at your medical history and offer treatment options for you. We offer both topical and oral minoxidil, so there's really something for everyone. We hope you liked this content and found it useful. If you want to hear more about content like this, like, subscribe, and comment, and we'll see you at the next one.